Universidad Católica de Santiago de Guayaquil. My topic is Emerging and Reemerging Sexually Transmitted Infection. Name, Gabriela Barahona. Definition. Emerging infections are the variation of the new appearances in the population, or the insidious rate of their geographic distribution is increasing very rapidly. Reemerging diseases are problems that were well-known public health problems in the past and have grown of the reappearance in the recent years. Sexually transmitted infection or disease STDs and thus caused by microorganisms that are transmitted, mainly by skin, mucosal contact with skin, mucosa, or by fluid exchange in sexual relations. There are different microorganisms that can cause this infection: fungi, bacteria, virus, and parasites. Some STIs mainly affect the genitals, but can also affect other areas such as the anal or perianal area in the mouth. In addition, there are STIs that can spread affect other organs of the body.
Youth Med Ed, medical students educating youth. In this short video, we are going to talk about sexually transmitted infections, or STIs. First of all, what is an STI? STIs used to be called STDs, or sexually transmitted diseases. An STI is an infection caused by bacteria, viruses, and parasites. There are more than 30 sexually transmissible bugs. When a person has sex with somebody infected, they may also develop an STI. Here are some common examples of STIs: gonorrhea, chlamydia, genital herpes, genital warts, syphilis, HIV, and Hep B. Over 1 million people around the world acquire an STI each day. That's equal to about half the number of people living in Vancouver. How are STIs transmitted? To answer this, we must first talk about where these germs live in the body. They can be found in open wounds such as cuts and scrapes, in blood, and in semen and vaginal fluids. STIs can pass from one person to another through any kind of sexual activity and even through some non-sexual but intimate actions. Am I at risk for an STI? There are certain risk factors that make some people more likely to develop an STI than others. Having sex with anyone without using barrier protection such as condoms increases your chances of acquiring an STI. Using injectable drugs also puts you at risk. Some helpful tips to protect yourself from getting an STI include using a condom every time you have sex, including oral or anal sex. Vaccinations can also protect you. While birth control pills and IUDs are effective at preventing pregnancy, they do not protect you from STIs.
Application in nursing. The nursing professional will monitor, systematically collect, analyze, and interpret data of health events or the related condition to be used in the planning, implementation, and evaluation of the public health programs, including the dissemination of information to choose the new turnout in the order achieve a more effective and dynamic prevention and the control action at different levels of control.
We're going to have a look at how infectious diseases are transmitted and a few different ways to control their spread. First, let's have a look at how people can get infected with these diseases. In general, there are three main components that need to interact with each other for an infectious disease to occur. This model of infectious diseases causation is called an epidemiological triad. The first component is the agent. This is the organism that causes the disease. It can be bacteria, viruses, parasites, or fungi. Second is the host, who is the target of the disease. The third component is the environment. This refers to the surroundings and conditions that are external to the host that allows the disease to be transmitted. In addition to these three components, transmission pathways between each of these allow the spread of infection. These transmission pathways can be direct or indirect. In direct transmission, the organism is transmitted directly to the person. This could be through touching, sexual intercourse, coughing, or sneezing. On the other hand, in indirect transmission, the organism is transmitted via an intermediate. There are several ways that this can occur. It can be through contaminated objects such as toys, soiled clothes, or even through food or water. It can also be through an intermediate vector such as a mosquito or a tick. Now that we know how infectious diseases are transmitted, let's have a look at how to control them. Changing behavior can reduce or eliminate the risk of exposure to an infectious agent and prevent their spread. There are many different and sometimes simple health behaviors that can be adopted, including using condoms to eliminate or reduce the risk of sexually transmitted disease, regular hand washing, having a healthy diet, or using insect repellents. Behavior change is an important target of health promotion programs. Vaccines are one of the biggest successes of public health and have led to reductions and in some instances eradication of infectious diseases. Routine immunization of children has led to a dramatic decline in diseases like measles, diphtheria, and pertussis, saving countless lives. Vaccines not only protect the individuals, but by increasing the level of immunity in the community, also protect others. This is called herd immunity.
Pros. Having a sexually transmitted disease at present is not something that can be treated. By taking a strict treatment, the person can be cured. Moreover, some cases have already been seen. Cons. Sometimes it is impossible to follow a strict treatment because many times patients do not have enough money to contract the infection. Issue applied in Ecuador. In Ecuador, 2015 had been the year with the highest number of medical consultations for sexually transmitted disease, 246,188 in the period 2013-2017.
What is STD? Sexually transmitted diseases, STDs, are infectious diseases that are most often spread by sexual intercourse. STDs can be spread through various ways. It is wrong if you think you can only be infected through sexual intercourse. How do STDs spread? Have oral, vaginal, and/or anal sex with someone who has the infection. Have more than one sex partner, or have sex with someone who has had many partners. Don't use a condom when having sex. Direct skin-to-skin contact with the mouth, anus, or genitals. Sharing needles or syringes for drug use, ear piercing, tattooing, etc. How many people get STDs? Over 110 million people are living with STDs in the US alone, as well as an estimated 400 million people worldwide. In the United States, about 19 million new infections are thought to occur each year. Almost half of new infections are among young people ages 15 to 24. 1 in 4 teenage American girls has an STD. How to prevent STDs? Don't have sex. Be faithful. Use condoms correctly when you have sex. Have a yearly pelvic exam.
Conclusion. Sexually transmitted infections are a large number, infections produced by different agents. In some cases, they can be transmitted non-sexually. Their frequency has increased since are strongly related to the sexual behavior of population. A group of them do not have definitive treatment. On the other are associated with the appearance of different cancers. If the prevention involves changing behavior, we can all be achieved through education, where we young people in the healthy lifestyle habit detection and the where we a rich population.
Statistics show that 50% of all Americans will be diagnosed with an STI or STD by the time they reach adulthood. So that shows you in some way how common STIs and STDs are. The most common STI or STD in America is chlamydia. And the second most common is HPV or human papillomavirus. Chlamydia is very common. It is asymptomatic in most people, which means there are no symptoms. So the only way to know that you have it is to be tested. It is completely curable and treatable with antibiotics. The really important thing to know about chlamydia is if left untreated, it can cause infertility in both men and women. In women, it can lead to pelvic inflammatory disease or PID, and in men, it can lead to an inflammation of the epididymis, the tubes through which the sperm will shoot out from the body. HPV is human papillomavirus, also known as genital warts, is also a very common sexually transmitted infection, and that is caused by a virus. It is treatable but not necessarily curable. It's very transmissible from skin to skin contact. So the best way to actually prevent it is to have a barrier between your skin and someone else's skin. Someone may transmit HPV even if they don't have symptoms, but the things to look for are warts or raised bumps on the shaft of the penis, on the outside of the vulva, around the rectum. Sometimes those look like warts, sometimes they're flat, sometimes they're actually not visible to the naked eye, and you would need to have your provider check in a different way. Sometimes they squirt a little bit of vinegar into the vagina, around the vulva, or on the shaft of the penis, or around the anus, in order to be able to see